Hi, I'm Mally Shansfeld, Editor-in-Chief of Orthodontic Practice US, a MedMark publication. Welcome to a live presentation and question and answer with Dr. Alexander Waldman and Dr. Alfred Griffin III. In our webinar today, we'll be exploring firsthand how to implement LightForce into your practice, how to offer these new brackets to your patients, and everyday best practices while using this system. Dr. Alexander Waldman of Waldman Orthodontics in Beverly Hills, California, is an avid fan and user of LightForce Orthodontics, which was created by Dr. Alfred Griffin III. Dr. Waldman's practice has fully adopted the LightForce system with many cases in progress and has been pleased with the everyday workflow of this fully digital bracket system. Before we get started, I'd like to invite viewers to use your question box in the control panel to ask any questions that you have, and your questions will be answered at the end of the session. Also associated with this presentation is a free CE quiz. At the end of the webinar, we will email all attendees instructions on how to access the CE quiz. I'm pleased to introduce our guest for today. Dr. Alexander Waldman is a diplomate of the American Board of Orthodontics and a triple Ivy League trained orthodontist. He received his undergraduate and dental degrees from the University of Pennsylvania. Dr. Waldman completed his fellowship in orthodontics at Harvard University. His private practice in Beverly Hills is recognized as one of the leading orthodontic practices in the United States because he blends the latest research and technology with traditional, evidence-based orthodontic techniques to provide patients with accurate, cutting-edge, and comfortable orthodontic treatment. Our other guest, Dr. Alfred Griffin III, is a second-generation orthodontist from Virginia and is the founder and CEO of LightForce Orthodontics. He has a Master's of Medical Sciences from Harvard Medical School, his certificate from the Harvard School of Orthodontics and Dentofacial Orthopedics, and his DMD, PhD from the Medical University of South Carolina. His bracket research has been published in multiple orthodontic journals, including our very own Orthodontic Practice US magazine. He holds the patent for customized orthodontic brackets using ceramic 3D printing methods. I'm now going to turn the webinar over to our doctors to learn more about this topic for today.
Thanks so much, Mally. We're happy to be here and excited to work with Ortho Practice US. I remember getting your journal in our mail growing up, and it's been fun to see the transition to digital. Great examples today. So we've been very focused and passionate about creating a company by orthodontists for orthodontists. A little more color on that. So I come from a dental world. My mom was one of two females in her dental class. My dad is an orthodontist. His dad was a pediatric dentist, and of course they met in dental school. People usually laugh at this part, but our family vacations were actually to the AAO and to Anglemead. So that was both a function of these being in incredible locations year after year, and also that they're a tax write-off. So good reason to go to these meetings. So after school, I would get dropped off at my dad's practice, and I would watch him bend a lot of wire, repo brackets, and sometimes he would put me to work making Essex retainers and the like. But I would always ask him, why are you doing that? Why are you bending wire, and why are you repositioning brackets? And his answer was what we all know, is that every patient has unique jaw relationship, jaw shape, tooth anatomy, tooth shape, and the puzzle, it just comes together differently for every patient. And we use a one-size-fits-all appliance today, and have for 70 years. And so our ability to bend wire, repo brackets, that artistry is what allows us to match patient needs. And so our goal with this technology was to create a digital approach, not an analog one where we're making sub-millimeter bends with pliers. So I founded LightForce with Dr. Lou Schumann, my first year of residency, with the goal of customizing our tooth moving tools and creating a company by orthodontists for orthodontists. Like Lou, my dad, and Alex, Dr. Waldman. Digital technology has been a passion of ours, and what we've done so far is not exactly a brilliant idea. We've been after this for a long time, 70 years. We just have not had the technology to apply to make this happen and to execute on that idea. So our first product on this platform is what we're calling the cloud bracket, which Dr. Waldman is going to talk about today. So Alex and I met last year at the AAO. at our booth. We did our first beta launch, and he was one of our first 20 beta users. He's since then become a great example of what we expect from our users, a thoughtful partner for both the company and me personally, and someone that our whole company takes pride in listening to, our engineers, our whole team. So again, Dr. Waldman is a very forward-thinking orthodontist, and it's not a stretch to say a pioneer of the digital age that we're all coming into. And I'm very excited to hear what he's going to say today. So I'll send it over to you, Dr. Waldman.
Thank you, Alfred. Okay, so first of all, welcome everyone. It's nice to be here and have this opportunity to share this incredible information with you. Alfred, thank you for your kind words. And thanks to Ortho Practice US for giving us this opportunity to share our experience of using this really forward-thinking product with you today. So let's get started. We will get started here in a second. There we go. Okay, so for those of you who don't know me, just a little bit about myself. Like was said in the introduction, I finished up my ortho program in 2003. Actually, Alfred and I went to the same program. He's a lot younger than I am, but a lot smarter, so that probably balances out there. And I've been in practice here in Beverly Hills, California for 17 years. And we're a single location. We have 14 staff. 3 of those actually, interestingly, work remotely. So we have 11 staff in the office, 3 people working by logging in, taking advantage of this virtual age that we're living in. And we're about 50-50 kids and adults, shown here with myself, as well as my associate, Dr. Oscar Reina Blanco, another Harvard graduate, as well as some of our staff. So in college, I was actually not a biology major, I was a history major. And when I think about orthodontics, I tend to think very historically. So just, a second about where we've come from and where we're going. Obviously, our profession was founded by Dr. Engel, was advanced in terms of diagnosis and treatment planning by Dr. Tweed, and then some of the names that we're more familiar with in terms of the modern generation of braces, Dr. Roth, Dr. Andrews, Dr. McLaughlin, people who are still making a mark on our profession today, and who essentially ramped up the profession of orthodontics into what they call the golden age of orthodontics by creating the fundamentals or the basis of the straight wire system, which is essentially what I would say probably 95% of orthodontists use for their fixed appliance today. So we have an incredible sense of indebtedness and gratitude towards these pioneers. But I think it's very appropriate to add Dr. Griffin to this slide, because we are now at a significant inflection point that after about 100 years of braces, probably I think more than 100 years now of braces, we now have the technology to be able to deliver on, I think, what was the dream of every step in the generational evolution of the fixed appliance, and that is to say the full customized bracket and a true straight wire system. So we're going to learn a little bit about this today and see what the future is going to look like for orthodontics.
That's a bit much, but I appreciate
it. Thanks, Alfred. It's true. Okay, so what is LightForce for those of you who do not know yet about it? First of all, it is a 3D printed fixed appliance, i.e. braces, and a 3D printed set of indirect bonding templates that accurately place those brackets onto the teeth. Obviously, any digital braces is going to involve a software component, and then of course we have scaled manufacturing, which is going to enable efficient and nimble production of this appliance by use of 3D printing. And of course, 3D printing is the heart and soul of this technology and what really makes it possible. And so I kind of like to think, and I've told this to Alfred, that if Edward Engel was alive today, he'd be an avid LightForce user, okay? Because this was the dream of the early generation of orthodontists, but of course they had to do this by bending wire. Okay, so now that you know what LightForce is, why would you use it? A lot of people will say, I'm very happy with my standard analog mass-produced brackets, we get great results. We've always gotten great results. So why use LightForce? There's a lot of answers. The first one is that we live in an age of unprecedented competition, not only from internally in the orthodontic industry, but externally as well, with all the direct-to-consumer products that are available. And we need to maintain our specialty. Both, Dr. Griffin and I, as well as others, really believe in this, that our specialty is being penetrated by forces that are not necessarily healthy for patients, for proper orthodontic diagnosis, treatment, and care. And we need something that will sustain our specialty status, but also differentiate us and allow us to enter the digital age. And LightForce is just the perfect product for that. LightForce is great for both kids and adults. It's a custom prescription, and we're going to wrap our heads today in this webinar around what that really means. Just checking my time, make sure that we can do this in a in the allotted time. We are going to focus a lot about how having a custom prescription really changes how we think about fixed appliance therapy. Because of the nature of the 3D printing of the appliance, there are incredible custom bracket features we'll talk about, an incredibly elegant digital indirect bonding solution. Once we have the bracket and the understanding of the mechanics in the appliance, we'll see that this opens up an incredible new world of opportunity for practice management and practice efficiencies, which will be fewer visits, faster and better finishes, happy patients. And that also enables, of course, the full digital practice. A lot of orthodontists are using aligner therapy in their offices, and they're aware of the efficiencies that come along with having a fully digital practice and having a fully customized practice. We haven't had really that full engagement on the fixed side, but I do believe that LightForce will be an inflection point for fixed appliances with regard to digital engagement. And it's really impossible to give this webinar without, of course, recognizing the very difficult state of the world that we're in now with the coronavirus. And this is something that really is going to change, I think, a lot of how we run our practices, how we think about orthodontics. When we have to shut down, when our patients are suffering because we cannot get to them and physically treat them, suddenly the efficiencies of yesterday that were just a convenience or a cool way to do things have now become really a necessity. So being nimble, being able to treat patients with a smarter appliance that's digitally programmed, that allows for fewer appointments and still maintains the same, or if not increase the quality of treatment, in fact. These are things that are going to become a real change in our profession. So I think this conversation that we have, although the world is going through an incredibly sad state right now, this is something that as a profession, I think we need to be armed with for the future. Yeah. So you might ask, how, like we said before, I'm an orthodontist, I can do great work just with my standard brackets. Why do I need a customized system? And what you might not realize is that you're actually already customizing your system. How is that? Well, you may be an orthodontist who is using various torques for anterior teeth in different cases. Maybe you'll use a high torque, a low torque. And that's a way of customizing and understanding that my standard prescription that I use, whether it's MBT or Roth or what have you, is not sufficient to actually treat this case. This case needs something different, something additional. Or we might use a more of a bidimensional approach to be careful about our anchorage. In sliding mechanics, extraction cases, we'll use different brackets for anterior and posterior teeth. We may, in cases of missing teeth, we may flip brackets from the lower to the upper, upside down. And that's a way of customization and us recognizing that our systems are really not sufficient. We'll add on ties and hooks because the brackets don't have them. We'll use different thickness wires to engage different amounts of torque, because we know that that amount of torque built into the bracket is the same for everyone, but everyone's different and it may not be appropriate for that patient. So we'll go a little bit lower, we'll fully engage, we'll go up to a 21, 25, we'll stay in round wire. We're constantly playing with the system to customize how the brackets will work for that patient instead of creating a bracket that is made for the patient. And of course, it wasn't done before because it couldn't be done. Like Dr. Griffin said, the technology was not available, but now with 3D printing, it is, and it really fulfills this vision of the generations of orthodontists that have come before us. There's my historian again. Okay, so of course we also, and this is the most fundamental, we do have to bend wire still. And to finish a case to a board standard, we're either doing a lot of rebonding to compensate for all those anatomical differences in the teeth, or we're going to be bending wire, or maybe purchasing an expensive system to create custom wires. So the fact is we do a lot of customization already. Now, other concepts and companies have recognized this, and LightForce is not the first commercial product to recognize the kind of inherent weaknesses of the straight wire appliance as we have used it for the last number of years. Straight wire, what, last 40, 50 years, something like that. And by the way, just as a side point, it's incredible that when you see how society has changed, how the world has changed, how technology has changed so much, we are still actually using braces that were developed, in the Nixon era or something like that. It's really, kind of crazy when you think about it. So I think as orthodontists, we should be really excited to have something new in our hands to enhance our specialty, to elevate our specialty to the next level of care. Okay, so let's talk about these systems that have tried customization in brackets. And of course, these systems were created because they do recognize the limitation of this standard analog brackets. They're an attempt at what I would call a true straight wire system. True straight wire meaning the brackets are so perfectly created for each individual tooth and malocclusion that all you need to do is pop a straight wire in there, and if you change the wires in the right sequence and see the patient in the right sequence, you will magically get that beautiful alignment and that nice result. Of course, it's not so simple. We need elastics, we need bite opening bends, things like that. But in general, the idea is the brackets will get you all the way there. And unfortunately, these previous products were limited by being an older technology. They were stock brackets adapted to or welded onto a stock base, no true custom base fitting on the tooth. Because of that, they have to be a larger profile. They're hard to replace, very complex, manufacturing system, and they take a long time to create, and they're only available in metal. Another concept was, okay, well, let's accept the inherent weaknesses of the brackets that we have in the current straight wire system, but let's make up for it in the wires. Get your brackets on any which way. You know they're not going to kind of work perfectly for the patient anyway, but the wire is going to be created to make that perfect. And this also accepts the limitation of standard brackets, and it solves the need for customization through the wire. Unfortunately, it allows for round tripping, which we don't like, and it's inefficient because when you get to the end, then you need to, and if you're not there yet, you have to get another wire, and this time to make that. And it's just, it's kind of thinking a bit backwards in my mind. We want to be thinking about getting the brackets on right and having the actual correct information built into the bracket. That is the true straight wire concept. So with LightForce, we're able to achieve that because 3D printing is actually what changes everything. And the ability to 3D print a bracket that is perfectly fitting on a patient with the proper prescription is actually the holy grail of orthodontic treatment, and really has been for the last 100 years. So let's talk a little bit about what it means to have 100% custom prescription. I love the logo, Dr. Griffin, very well done on that the patient is the prescription. There's no set prescription. We move the teeth where we want them to be for that individual patient. And just that concept alone, for me, was enough to resonate, to make me engaged in this and to be interested and to learn what I could do if I had the full power of this appliance. So obviously, we're going to have every dimension of tooth movement, first, second, third order, tip, torque, in, out, will be able to be custom programmed per tooth, per patient, per malocclusion. We don't need custom wires because it is a true straight wire system. Everything is in the bracket. So you can use any wires that you would like for it. The nice thing about it, it's very familiar. It's a very easy transition for both the doctor and the staff to switch over to this. A lot of technologies that are out there that are custom technologies are very complicated or have very interesting wire systems that are really different in terms of mechanics. There's a lot of learning. You almost have to like relearn orthodontics to be able to use them. But this system is braces. It just braces, you know, at light speed, LightForce, okay? It's very familiar, so it's very easy to make this transition. And we were able to convert over pretty much immediately once we made the decision that we wanted to have this technology to offer to our patients. Interesting things you can do. For instance, a concept that people are talking a lot in terms of bracket positioning is smile arc protection. If you think about smile arc protection, it's great. You know, you place the anterior brackets more gingerly, extrude the teeth, protect the smile. Fantastic concept. But we know that if you take a standard bracket and put it in the wrong place, it's going to express the wrong torque. But not with LightForce. You can put the bracket anywhere you want on the tooth and customize that torque. So just that concept alone as an example should show you how powerful this is. LightForce, I think, can and should be used for all orthodontic cases, but it really stands out in those really challenging cases where you might have had a canine substitution, interdisciplinary case, tooth size discrepancy cases where a standard bracket system just doesn't work. It just doesn't make sense. And so you need that extra level of customization. Alfred, is there something you wanted to add to that in terms of the types of cases that you like to see with LightForce?
I was just going to add to the previous slide. One of my good orthodontic friends in Birmingham, Alabama, refers to the argument as smart wire, dumb bracket, or dumb bracket, smart wire. I prefer to say that it's smart bracket, straight wire. But there's a lot of consensus that if we could, the best path would be smart bracket, straight wire, for the reason that you so eloquently mentioned. But cases, yeah, to your point about that, you know, there really isn't a case that would be better treated with a injection molded bracket. I mean, we've done plenty of cases at Boston Children's on the craniofacial cases where you're looking at a lot of canine substitution, premolar substitution. People are doing surgery first cases, impacted canines, mixed dentition. So one of the strengths of the engineering team is we say, all right, here's a case that we don't know how to do yet, figure it out. And that's one of the benefits of working with, you know, all these Boston-based, Harvard, MIT engineers. They are very creative, and having them in our orthodontic space is great for the profession, I would say. So
yeah, absolutely there. Now, you know, really it comes down to the slot, you know, and we know, we were trained as residents, we know from the research base that the traditional slot in an injection molded bracket, which is how most brackets are made today, has excessive play, mainly because of how it's manufactured, and you need to get the mold out, and it just can't be completely really parallel. It's very hard to do that with that technology. So you can see that if you would put a rectangular wire in, you're inherently going to have a amount of play. And I believe that the numbers that are bandied around, that if you take a look at the torque differential, even in a fairly large wire between two teeth, that torque differential could be off 40, 50 degrees of play, meaning that we're getting a lot less control from our wires than we actually think we are getting in a traditional slot. And 3D printing really changes that, because what I've learned from Dr. Griffin, and actually from my experience with my own 3D printers in my office on a different scale, not at this level, is that 3D printing is really good at printing things that are straight, flat. It's harder to print something curved with 3D printing, but it's very easy to print something flat. So taking a look at the photo here on the right, you can see that wire will fit perfectly into there. And so not only, here's the thing about LightForce, is that not only are we able to program the correct amount of, torque for that tooth, but we're actually able to get it because of the inherent characteristics of the bracket are better than an injection molded bracket. On the left there, you can see this is a 1725 steel wire in an 18 slot. and just how incredibly well that fills it. Imagine if you went to a full slot on that. You would essentially get every bit of desired torque. Because again, in a regular system, there may be torque that you don't want, right? And so we're afraid of it. We're afraid of engaging the wire, actually. But in this system, we want the torque. So this is a proactive, smart system. And we'll talk about wires and how we work it out a little bit later in the presentation. So let's talk about slot size now that we're on this topic. So LightForce is available currently in 018, 022, and 020, or any custom combination. Now, of course, traditionally, we've only had 018 and 022. The ability to create a third party, if you will, like a three-party system, American politics, that third party, we've only had two parties, right? 018, 022, Democrats, Republican. Not a lot of independents out there. But now we do have this 020. I'll talk about that in a second. But you can also take any of these combinations and mix them up per case. You could create your own bidimensional setup. You could create a single bracket that's different. Every case can be different. So this really opens up our game because, we are kind of on a practical basis. I'm a wet-fingered orthodontist. I run a busy practice, and it just doesn't make sense to have a lot of different prescriptions. Even if you work with different brackets, you kind of want to be in the same prescription so your wire stock and your kind of mechanics are similar. But that's only because, if you think about it, it's kind of backwards, because it's only like that because of the fact that we have to be like that, because it's not practical to stock so many different types of brackets. But if you're custom printing and custom creating a bracket system for every individual patient, it's actually easy to do. So we're suddenly able to think about maybe groups of patients. You might decide, in my practice, I like to treat non-extraction 018 and extraction 022 and surgical 020 or whatever it is. And you can do that with LightForce and not have any additional stock because you're only going to print what you need. So what do we use? People ask me. We use 020. And I am actually proud to say that I believe we are the first office to use the 020 prescription. To me, I've always thought about this. And to me, 020 was always the sweet spot. 020 was, you don't have the light wires needed for the 18 slot. You don't have the crowbars, needed for the 022 slot. It's just perfect. And imagine kind of, finishing a case in a 1925 NiTi that allows you to express all of the torque that's in those brackets. It's really a dream.
I would just add that 018 is pretty sweet too. That's what I use. So.
What? Sorry, Alfred?
As I would just add that 018 is pretty sweet too.
Yes, absolutely.
But,
I mean, yeah. It's really, and that's the thing about it. It's like, I was 022, Alfred's 018. I switched to 020 with LightForce. But the thing is like this, is that this is not a commercial entity telling you how to practice. This bracket system was created by a board certified orthodontist and is meant that you can customize it and use it any way that you like and that you want. So kind of the world is your oyster, and now we really have the ability to give you what it is that you want in your mechanics and your practice. And what I have found, interestingly, with LightForce is I am just like thinking about braces for the first time in a long time. I am excited about braces for the first time in a long time. Half of my practice is aligners, half of it is braces. And to be honest, until we started using LightForce, we were kind of like a little bit done with braces. We were kind of excited about all the innovation and technology with aligners, but there wasn't any innovation with braces. Now that there is, it is a total game changer for how we think about fixed appliance therapy. And it's really been an incredible journey. Anyway, kind of switching gears here from the prescription and the slot to the base. The custom base is really, for me, and I'll let Dr. Griffin chime in. I'm sure he has his own thoughts on this. But for me, the custom base has really been the most profound change in how we think about this, because it really is the world's first true labial custom base. We've had custom bases on the lingual for lingual systems, but in terms of how most people practice orthodontics, which is on the labial or the facial side of the tooth, this is the first one. Of course, it accounts for all of the aberrant morphology that we see on the teeth. It yields a very high bond strength because, as you see this photo here on the right, as these teeth fit digitally is how they fit on the teeth. And I'm going to show you that now. This is a case of mine. It was actually a very complex case, an extraction case. It was one of our first LightForce cases. And you can see, that's why you see on the bottom left there, there's a tooth missing because that tooth was extracted. I believe it was the lower left 4. And you can see how nicely that bracket on the lower left 5 was planned. Now take a look to the right and look at that bracket and see how incredibly closely it hugs the tooth and bonds to the tooth, and how accurate not only is the bracket printing, but actually the transfer of the bracket with the IDB tray exactly to where you planned it on the tooth. It is so powerful when you see this happen clinically. And so this is really truly a custom base. So why do we need a custom base? Because we're not used to thinking about custom bases. So it's not even in our wheelhouse. So it does take a little bit to understand what we're talking about here. Now, typically, if you take a look at the slide on the left, you'll see a situation where because of the differential thickness of the facial surface of the teeth relative to the wire, in this particular situation, the teeth were different sizes, the wire was straight, but the brackets were all the same size. So it's naturally going to pull the teeth into different facial, lingual, labiolingual positions in order to compensate for that standard bracket. Despite the difference in anatomy, you need to put a step in on a tooth. With LightForce, and switching over to the right now, the blue, LightForce will compensate. If we take a look at that, looks maybe it's like an upper right 5 or something, looks like. If we use a LightForce bracket, we're going to compensate for that by adding thickness to the base of the bracket, and suddenly no step is needed, and that becomes a truly straight wire approach. So the custom base changes a lot, particularly in the need for detailing. If you think about detailing, I don't know about everyone listening to this webinar, but in my practice, I'm really trying to get those cases detailed, and it takes a while, doesn't it? It takes a long time, sometimes visits and visits, and this is the time of treatment where patients really want to be out of their braces, and I'm just like spending time trying to be perfect, trying to get that board result, driving them crazy, driving the moms crazy. I think they appreciate the quality result in the end, but they don't appreciate the amount of time it takes to get there. And so just the very fact that you have a system that's built in to take care of this detailing up front is such a big game changer. Another kind of very interesting concept with regard to the custom base is we are accustomed to placing our brackets right down the center of the tooth. Why is that? Because that's going to keep the tooth from rotating mesially or distally. But the reason we need to do that is because the bracket only has one formation and is meant to be centered. With LightForce, the bracket does not need to be centered on the tooth to maintain the slot or the wings in a parallel position relative to the wire. Normally, if we would, let's say, as you see in this little GIF here, normally if we would rotate a bracket mesially on a tooth, we would get a distal rotation, right? But with LightForce, as we move the bracket mesially, the bracket base is going to compensate for that by building it out and keeping the slot essentially in the same position without rotating. And this is incredibly important clinically. Let's take a look at a case. You can see here on the lower right one, the bracket looks to be way too distal. And what you would expect to see is a significant mesial in rotation. Now, there's no bends in this wire, so this is a straight wire approach. And but what the software is doing here is compensating for a difference in the anatomy of the tooth that does require the bracket to be a different fit in order for that to maintain. So you might ask, well, why isn't the bracket centered? Well, if you take a look at this case when it started, the teeth were very crowded. We couldn't get the bracket on centered, right? So this is a way to not only get the bracket on early, but build in the information so it doesn't need to be rebonded, and that one bracket, by being programmed in the right way, will take you all the way home to the end of treatment. Let's have a situation like this, which is so common, where we have a blocked out bicuspid. You can see here that this tooth was placed distally. Again, normally if we place it distally, it's going to rotate the tooth to the mesial. So what do? We build out the bracket base on the distal in order to maintain a parallel slot to the straight wire system. And when the case finishes, it's going to look like that, okay? So even though the bracket is distal, and in our minds we think the tooth should rotate mesially, it doesn't because of the compensation in the custom base. So let's take a look at that case in real life. So this is how it looks. we're able to bond that. So now you know why we had to put that bracket onto the distal. Of course, it cannot fit any more measly. You would have had to delay your bonding until that space was made, and then that requires an extra visit to get the bracket on. This way, we're able to get this bracket on during the IDB process, and that's the most efficient way to maintain a minimum amount of patient appointments. We get the bracket on, we don't tie it in right away, but we do start to open up space. And then once we have the space and we can tie it in without rebonding it, this is what it looks like, perfectly aligned. And just showing you kind of how that bracket base is compensated in the software. Okay, so this is a more kind of interesting way to apply this. We want to think with the end in mind, and we're not used to doing this. So if we take a look at the photo on the upper left, we see a case where this bicuspid bracket seems to have been placed distally for no reason. We were able to access the bracket more on the mesial. Why didn't we place this bracket straight on the center of the tooth? And the answer is, if you this is the lower right bicuspid. The answer, because if you look at that lower left bracket, it appears that there was plenty of space to move that tooth mesially, and we wouldn't have to worry about custom base. We just put the bracket on. But the software, and this is where the concept really becomes very efficient in terms of using the digital processing, the software allows us to envision how the bracket will be aligned at the end of the case. If you take a look at the bottom right photo, we'll see that if that bracket was any farther mesial, that would have formed an interference and could cause a damage or wear against the opposing dentition. So we put the bracket where it needs to be, relative not only to the initial malalignment, but also to the end result, when for many, many months of treatment, that tooth will be derotated and in that position. So again, all these creative things we can do. One of the interesting things as well is how the bracket base adapts to a vertical movement of a tooth. Sometimes we need to move a tooth vertically to achieve gingival margin placement, maybe in an interdisciplinary case. There's examples, as we discussed before, in terms of creating the right smile arc. And normally, as we change the bracket position on the tooth, it's going to change the torque that bracket will express. But with LightForce, we're going to adapt to that within the base, maintain the slot at the same parallel and kind of continuous position relative to the adjacent slots, and able to maintain the exact torque that we want despite having a very different position. And just this concept alone is really, really fantastic, and we're able to maintain that straight wire system. Another thing, in a very similar application, is we have the ability to change the plane of the teeth. So with regular brackets, analog standard brackets, you do have to get them on somewhere in the center of the tooth for them to express the right amount of movement. But with LightForce, they can be really anywhere on that facial surface. There may be a reason in case you want to be more gingival, maybe to avoid occlusion in a deep bite case. You might want to be more incisal for whatever reason. And you're able to do that without affecting the relative torque of the teeth. So again, once we get into this digital programming, but not just digital, because a lot of systems are digital, but custom, and creating these custom bases and custom prescriptions, it's really a game changer how we plan our cases.
We've seen doctors put the brackets we've seen doctors put the brackets a little bit more occlusal or incisal on hygiene sensitive patients like teenagers, especially on the upper.
Yeah, and that's a great thing that we would not have been able to really do before. So really all of these things are just it's really a brave new world. And one of the things that's enabled by 3D printing are customized auxiliaries. And this is showing you what I think is like really such a profound breakthrough, which is custom bite turbos. And one of the things that takes time in a deep bite case, or any case where we have an inability to place all of our brackets at the same time without having occlusion on the brackets, etc., is the fact that the doctor has to place, or a well-trained assistant has to place bite turbos and a lot of adjustment to get them even for the patient, get them feeling right, get them just at the right height. It can take actually quite a while. So what LightForce has developed is a system to use an IDB tray, they're called turbo trays, to be able to digitally design the bite turbos that you need, use a transfer tray, and then have the assistant who's doing the indirect bonding be delegated to do this task, and you can get a perfectly positioned in terms of height, size, exactly the turbo that you need in the right place without having the doctor take the time to do so. And we use a lot of bite opening in our practice because we do like to, for efficiency's sake, get all the braces on the same day. And this has been such an incredible breakthrough for us in terms of time saving, accuracy, and just, general efficiencies. Another thing that 3D printing allows us to do is to customize the auxiliaries like hooks per patient. So you may have a patient that for hygiene reasons you don't want any hooks, and you can design that. Or you might have a class 2 patient where you only need hooks, let's say on the upper 3s, and you can design that. Or you might have a vertical case where you want hooks on like everything, and that can be done as well. So that kind of engineering, that kind of flexibility and customization simply has not been available, and is only available because of the 3D printing process. All right, so that's a little bit about the actual bracket and how that works. Let's talk about the LightForce software. So of course, any digital braces system is going to require a good engine to run it and to plan these cases digitally. So from having done a lot of cases in the last 8 months or so, since we were able to start using this technology in our practice, I can tell you the software is incredibly intuitive. Actually, no, I think it's more than 8 months now. It's I think it's about more like 9 or 10 months, almost a year.
You've seen the evolution for sure.
Yeah. The software is incredibly intuitive. There's no installation needed. It's a web-based platform, so you get instantaneous updates. When you submit the case and you get the first treatment plan set up, it's a very fast turnaround, and we'll get to that workflow in a few slides. Excellent quality setups. These are people who really understand orthodontics. And then you have, in addition to the initial setup you're provided, you're able to customize that. For those of you who are familiar with any kind of digital treatment planning software, just the kind of same thing where you can either make manual updates to it, or you can actually send in instructions to the technician to make those for you.
If it wasn't for coronavirus, I just mentioned that you would see about 10 of our technicians out there right now behind me.
Yeah, exactly. Working remotely now, yeah. So this is an incredible sales tool. And during the consultation, we will show the patient the software so that they can get a sense of that it's really not just like using words, oh, these are customized, but how we actually create these per patient, how we actually think about each individual patient's prescription, whether it's setting up the case with certain aesthetic parameters in mind, certain functional parameters in mind, and it really resonates with the patient. So we use that as a patient education tool, chair side as well, either the day of the bonding to show them the case we've set up for them, to show them what we'll be doing. And there's some great features in there where you can kind of toggle back between the initial and final stages using a video timeline. Patients can really see their teeth move, and it's extremely empowering. We just had nothing like this before with any kind of braces system. So this is what your main screen will look like when you're in the treatment planning software. On the bottom, you can see some of the controls that you can toggle on and off. For those, again, who use any kind of digital system, it's going to feel really intuitive, really easy, really comfortable. And then, of course, on the right side, you'll see the panel where we're going back and forth with the technician to kind of finalize that plan. You'll also have a panel where you'll be able to see your dashboard, all the cases that have been shipped, be able to get back into the treatment plan, to be able to pull it up chair side and have an incredible resource being able to track these patients digitally. Okay, so let's talk about indirect bonding with LightForce. So we've been using indirect bonding in our office for the last 6 years. I've been doing it for longer, but we decided 6 years ago to go full on for every case. So we've done a few thousand indirect bondings in the last few years. And that's been mainly very analog, using kind of plaster and a traditional IDB setup. And I can tell you from having done a lot of research, different companies that are offering kind of IDB solutions. LightForce is currently the best IDB solution, and certainly the best digital IDB solution on the market. It's very easy to learn. It's fully delegated. It's highly accurate. Opens up time for you as a doctor to focus on consults. So if you've done IDB in your practice before, you're going to find this to be extremely easy. If you haven't done it, you will find it to be extremely easy. Very, very adaptable for assistants.
I would just really quick, just to add to that, indirect bonding is truly a linchpin to any custom system, and that we recognized that early, and that was a project for over 2 years. So a lot of engineering time into that indirect bonding tray.
Absolutely, and when you feel the product and you work with it, you can kind of feel that attention to detail that it's been given and kind of thought through. You know, it's just very, very easy, and it just works perfectly, and it just makes so much sense with the digital system, because you have a bracket that fits perfectly on a tooth, and you have to get it there perfectly for it to work. You also need that tray to be perfect, and all the accuracies that are inherent in 3D printing is what makes it interesting. Now, this is just obviously not a patient, it's a model, but I think this is a really cool photo as orthodontist, just to show you where we're at. This is a 3D printed bracket bonded to a 3D printed model using a 3D printed transfer tray. So we are truly in the future already, just in terms of how things have changed so rapidly in this space in the last few years. And by the way, just one point of clarification, you do not need to print these trays. They are provided for you, and we'll see that in the box in a few minutes. 0 to minor cleanup needed once you learn how to apply the correct amount of adhesive to the base of the bracket. And the amount of adhesive is tiny, because these brackets fit exactly on the teeth. And so you don't want to have any excessive adhesive, because it'll just be excess. You need to just learn to place a very small amount to create a very strong and secure bond. Now, these brackets were designed from the ground up, and I'll let Dr. Griffin chime in if he has any thoughts on this, for indirect bonding. And I think we can probably say that this is the first labial bracket that was, maybe the first bracket ever, that was actually designed specifically for indirect bonding.
Yeah, I mean, that's true. So the face of every bracket was optimized for the indirect bonding tray. And that's what all those engineering hours were spent on, is optimizing that fit. So you could, our engineers used to take a tray and throw it against the wall and see if any brackets came out, because that's one of the issues that happens with indirect bonding is, you know, you paste it, the bracket comes out on the syringe, and that's not great. Also things optimizing the path of draw to take it off, making so that you don't have to put labial pressure on the face of the bracket when you seat it. Just by virtue of seating the tray all the way on the teeth, you're also applying the correct amount of labial pressure on each bracket. So kind of an Apple approach to product development. We try to take all of the things that can go wrong out of the system. Yeah, that's pretty much it.
Okay, thanks, Alfred. Okay, so when we put all these things together, the software, the brackets, the IDB, the bite turbos, essentially what we have created with LightForce is the fully delegated braces start visit. So obviously the brackets will go on with IDB, and the assistants can be easily trained to do that. The bite turbos will be placed using IDB trays, the turbo trays as well, and that will be placed by the assistant. The software has this incredible feature where it'll actually give you a model of the wire deflection. And I want to show you this, how on the left and the right, look how the software accurately predicted exactly where the wire deflection is going to be and how much it's going to be. Take a look at that upper left 5. Take a look at that upper right 2. And you'll see that what enables you to do is that while you're doing your treatment planning process, you're able to effectively call out what the first wires are going to be for the patient. And you can have that in the chart. So what we have done is essentially created a roadmap for an assistant to be able to fully carry a patient through completely independently. Now, of course, as an orthodontist, we're no longer the technician. And that is true of everything in the digital age. We have now become engineers, designers. Of course, we have our technical skills when needed, but the forward-thinking orthodontist is going to embrace his role as a global treatment planning expert. And we're going to have these tools to make the technical part of it easier. And for some of us, that's disappointing because we like to do our bending wires, including myself. But this is a role that we need to embrace in order to fully kind of take advantage of all of the aspects of digital care. Because having this will allow us to spend more time in diagnosis and treatment planning, in consult, managing the practice, and giving the patient ultimately a better result, because these brackets are going to be more accurate, they're going to work better, they're going to work faster. Last week, unfortunately, right before our office had to shut down because of this whole situation, we did a full IDB visit, start to finish, with hygiene instructions, patient out the door in 45 minutes. 2 arches, turbo trays, wires, hygiene instructions. So this can be an extraordinarily efficient system for your practice. And I think that, the technology aside, just the efficiencies that are built into here are worthwhile in their own right. A lot of people ask me, what happens when you need to do a rebond repair? You don't have that initial tray. Well, you do. You just have to cut it into individual units, and then the dental assistant can actually place that, because it's a delegated duty. That bracket knows where it needs to go, not based on the orthodontist's eye or hand, but based on its individual position within the tray. Alfred, do you have any thoughts on that one?
Yeah, that's the process for now. If any of our engineers are watching, you know what you're working on. So, but yes, you can today. What you get if you get the tray and you want to rebond a bracket, patients chew on ice, rocks, things you can't predict. So they're meant to come off, and if they do, you can take a lid cutter and trim the adjacent teeth off, pop it back in, put it on the teeth. So that's fully delegatable as well. And we're always optimizing to make it even more efficient, not just for you, but for your staff. So,
yeah. Okay, so let's shift gears again and talk about a practice management and clinical workflow. So obviously this is a huge differentiator. We're going to talk a little bit about new patient experience, workflow, inventory, some efficiencies on the treatment. So some of the verbiage and kind of the verbal skills we're using for our patients with regard to this appliance. We tell them it's a digital bracket for a digital age, and they get it, they understand that. And it allows us to offer a full line of patient-specific or custom appliances, referencing that we do aligner therapy as well. That's already and always been custom for 20 years, and now we're able to offer the same technology, again, due to 3D printing for their fixed appliance cases. My experience so far has been that patients, they love and they understand intuitively the concept of customization. In fact, many of them ask me, like, why doesn't everyone do this? Like, why wouldn't anyone want this? And for those of them who kind of don't quite understand why they're not getting the same analog braces that their sibling got or whatever, we explain to them the following, that imagine you went into a store and there was one size suit, and so you went into a men's shop or a lady shop, and there was one suit or one dress, and all they had was just one size, and everyone had to fit. So it'll be bigger on some, smaller on others, but everyone has to kind of squeeze into it or roll up the sleeves or whatever. I tell them that that's what we've been doing orthodontically for the last essentially for forever. At least in this kind of straight wire era that we've been working in. And in actuality, any patient who would come in with any malocclusion was treated with the same set of braces, as Dr. Griffin mentioned earlier. And I tell them, can you imagine a class 2 open bite or a class 3 crowded case or a yada, 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 will all get the same bracket, and they are aghast. So I said, rather what we're going to do is not have any suits in this store that are pre-made. We're going to make you a custom suit, and that is kind of the analogy, and they get it right away. They're also told, of course, that treatment will take less time and require fewer appointments because we're dealing with a smart appliance. We don't need to be reactive. We don't have to say, put a wire in and kind of see how that interacts with the braces, see what the result is. We have an expectation of where this case is going. It's been pre-programmed, and we need to be proactive in terms of changing our wires and filling that slot and getting there because we want to fulfill that prescription. And they understand that. And anything that saves time is easier, of course, is very attractive. In our practice, we also use a lot of remote monitoring, and we found the system, because of the digital nature of it, because of the program nature of it, to be extremely synergistic with our remote monitoring processes. Talk a little bit about the digital workflow. How does it work? How do you get a case going? Well, you take a scan. You're going to submit the scan, very similar to any other digital orthodontic workflow. You're going to allow 2 business days to have your treatment plan ready to review, 7 to 10 days for manufacturing, a few days for shipping. So what it comes down to in terms of timing, so it'll take 3 to 4 weeks, and somewhere it'll fall into that based on how much kind of additional information you want to add to the treatment plan, how much you want to further customize it. There's not a lot of customization because the cases look really, really well set up. So most cases can be delivered in 3 weeks. We're currently allowing 4 weeks from the time of the scan to the appointment, to the scheduled appointment, just to make sure that we have sufficient time in the cases here for us when our patient comes into the office. Now, what are the treatment efficiencies? No question, this helps to reduce the total treatment time. The brackets are more accurate. They take you to that final tooth position faster. It's going to reduce the number of visits because there's less detailing, there's less playing around with the appliance. The appliance gives us more. We have started to increase the interval between the visits to allow for the third order NiTis just to do their work. And that will also help us to reduce the number of wires per case. The goal is to get into a third order NiTi very, very early in treatment. So we are taking advantage of that custom prescription in kind of the early part of the case and let it kind of take us through. And you'll see some of that when we go through cases. And so we're looking at, for a non-extraction case, basically looking at a 3-wire sequence. The first wire will be like a light or medium-sized round wire, then transitioning either to a square or a light rectangular, and then going into the final large rectangular to fill the slot. And of course, what we're seeing is that this is just NiTi, that we don't need the TMA or the steel to get the alignment or to do the detailing because it's in the bracket. We may need a TMA or a steel maybe to do a little bite opening curve, things like that. But in terms of actual alignment, no. So I was 022 with my, traditional injection molded brackets, and we were starting with a light round NiTi, going to a larger round NiTi, going to a smaller rectangular NiTi, into a larger rectangular NiTi, and then eventually into some form of stainless steel or TMA finishing wire, 1725 and a 22 slot, 1925, sometimes up to 2125 if we needed that torque. With LightForce non-extraction 020, we're currently doing basically a light round wire in a crowded case. You can go larger, obviously, if it's not as crowded. Getting into a square wire very early, ideally at the second visit, and then at some point we're going to transition to the 1925 NiTi. And that's just my personal take on it. Of course, the beauty of the system is that you can do whatever you want in terms of your wires, but you do need to be thinking about efficiency to really maximize the inherent kind of data and efficiencies that are built into the actual prescription. One of the most profound things in terms of how you change your practice when you start doing digital braces is inventory management. These are all the different types of bands and brackets that we have to be able to manage all the different types of cases that we treat. And that's all within one prescription, 022. It's a lot of stock that you need to have and to maintain. I think when we start to face times when things are good and we can afford to maintain inventory, maybe there's not a problem with that. But I think it takes a crisis to really see what's worth spending money on, And in this crisis where we are unfortunately not able to see patients on a routine basis, and it's going to really change how we practice, I think that having a custom bracket that is ordered per patient, and you're not holding any stock, you're not holding $20,000, $30,000 of stock of brackets, is a much smarter way to practice and will help to recession-proof your practice. Let's take a look what's in the box. So on the right, these are the indirect bonding trays. In the middle are the turbo trays. It comes really clean, really nice and neat. And then on the left side of the box, you'll have an extra set of brackets that are there in case that kid does bite down on that lollipop or that piece of ice and pops a bracket off. You have a bracket ready to go. You don't have to reorder it. It's right there for you. And so this is really, I think, an incredible part of the system, because it shows you the value of the 3D printing, that production can be scaled and you can easily have a backup set right there to go. Okay, we're orthodontists. We like to see cases, so let's take a look at a few cases. And Dr. Griffin, before I get into the cases, do you want to make any comments on the last few slides?
Maybe just what you get, it comes preloaded, so you don't have to put any brackets in there. Again, it's very difficult to mess up. Your staff won't.
Ready to go. Yeah, so easy. My staff, they just took like right to it, and they really love it because I'm allowing them to be so independent, and they can really, show the patient their skill set and their expertise in orthodontics. So it's really, really delegatable. So we're actually loving that. Let's take a look at some cases. This is a teen case. This young lady is about 13 years old, came into my practice with a full permanent dentition and crowded teeth. So this is the day that the brackets actually went on. A nice thing about LightForce is that colors look amazing with them. So of course you can do white or clear and keep it as an aesthetic system. But we find that a lot of the kids, even the adults, love how the colors look against that white background, and they find that they even look better than against the metal, because the metal kind of competes with the color and the white really highlights the color. So this is something that's really really great for kids. Anyway, so this is how the case looked when we first tied it in. I believe it was an 013 copper nitide, or maybe an 014 copper nitide that we placed in on the first day, and we reappointed her 10 weeks later. At the 10-week progress mark, we bonded the 7s, which we did not do at the first visit. You'll notice some bite opening there on the 4s, and I believe this was before the bite turbos came, which was a few months ago. This is one of our, I guess, first cases, so we had to place the bite turbos ourselves. But either way, we tied in larger wires and let her go. But just to show you what this looked like 10 weeks in, you can see that the case is almost perfectly aligned. Take a look at the in and out discrepancy on the lower 2s and 3s. Now we know this case is going to align pretty well in 10 weeks with any bracket system, but if you take a look at that lower left 2 and 3, look how perfectly the incisal relationship is already aligned. And that is really the beauty of the LightForce system, that very early on, you're going to be getting this incredible alignment due to the highly accurate custom bases, which just guide the teeth into the proper relationships in and out, and you can immediately start getting involved on torque and all the other things that you have custom planned for the case. Okay, it's not perfectly aligned yet. We see a little rotation of lower right 2 and 3, but I would say one visit in, we're doing very well. And I would confidently say that we'll be able to finish this case in probably 8 to 10 months. One of the things that I found to be incredibly powerful with LightForce is the ability to really think through these interdisciplinary cases. We do see a lot of adults, and we have this. I think as a specialty as well, because a lot of the easier cases are going to be kind of siphoned off to general dentists and to direct-to-consumer. We're going to be seeing in our practices a higher percentage of more complex cases, surgical cases, working with other dental specialists, prosthodontists, periodontists, and some of these more difficult cases. And so having the tools to be able to speak the language and be able to kind of transmit our thoughts through this digital interface is going to be very important. This was actually a transfer case that was in aligners, moved to Los Angeles. She's congenitally missing the upper 3s, and the 2s had some restorative work, I guess, at some point to compensate. They're trying to close the spaces, and it's kind of coming along, but she still has a deep bite. They're still spacing. And if you take a look at the gingival margins, nothing really has been set up for the final prosthetic treatment. You take a look at the photo on the top, see that the gingival margins are really all over the place. The upper ones, 8 and 9 are not aligned properly, 7 and 10 are not, and then the bicuspids, which are going to serve to substitute the canines, have not been intruded at all. And we do want to intrude those because we want to be able to then extend and lengthen them so that the gingival margin is in the right place and the incisal edge will be created to mimic the canine. So you can see in the middle, the digital setup that I worked with the prosthodontist online, logged him into my computer, showed him what we were doing, and he was able to really dial that in with me in terms of what he was looking for in terms of the gingival margin setup. And we just had no tool prior to really doing this. But then the real take-home message is that despite the fact now that we're intruding the bicuspids, that we have a different position of the bracket on the upper ones, the torque is maintaining the correct torque of these teeth because of the ability to dial that into the custom base. And that is just such a profound change in how we're used to thinking about these cases. Let's take a look at some other cases. This is a case just with some very severe rotations. Take a look at that upper left 3 and a fairly significant deep bite. And I'd like to thank Dr. Griffin for sharing these next 2 or 3 cases with me from his experience with this. And you can see that there was some bite opening placed to clear the lower incisor brackets, and we let the wires work. And this was the final digital setup. And this is the final result. And you can see how closely that actually matches the setup. And really shows you the efficiency of this treatment. In the next case, we have a blocked out lower left 5, some incisal crowding. Brackets were placed with IDB. We opened up some space for that lower left 5. And there you go. Again, this was done before the bite turbos were available, so a little bit of bite opening there on the 4s. And that's 5 months. And in 7 months, this case was finished. And I don't know about everyone listening to the webinar, but in my practice, these cases just, even in the best case scenario, did not finish in 7 months. And this is due again to this customized appliance that's allowing us to be extremely efficient with appointments, extremely efficient and very pointed and directed with the tooth movement. And here's a very interesting case that Dr. Griffin treated with, and I'll let him comment on his cases in a second. Thanks, Alfred. But this case was a lower incisor extraction. And despite the deep bite and a little bit of overjet there, at the end of treatment, because of the torque programmed into the lower incisors, we're able to maintain a beautiful, a beautiful overjet overbite relationship. And if you take a look at the cephs, we can see that despite taking out a lower incisor, in a case that wasn't, there was a good amount of crowding, but not the most severe. So we would expect normally in that case that we would at least maintain the incisors in the same position, or they would come back a little bit. But in this case, due to the torque that we custom programmed into the lower incisors, you can see that on the lower right there, if you look at those 2 lower images, able to actually advance and torque those incisors despite being a lower incisor extraction case. And these really just highlight the unique features and the ability of this appliance system to treat the most difficult cases, but to bring the efficiencies even in the simplest and kind of easiest cases in your office. So that was a LightForce engineer.
That was a LightForce engineer, so he put his money where his mouth was, or his job where his mouth was.
All Are you ready for some questions? Thank you, Dr. Waldman and Dr. Griffin. I do have questions, but before I get to those, I'd like again to invite viewers to use the question box in your control panel to ask any questions that you have. The first question that we have is for Dr. Waldman. What areas of your practice have you seen an impact from using LightForce, from using what LightForce provides?
Well, I think it's kind of in that little wedge where, you know, there was talk a few years ago of just aligner therapy taking over orthodontics, you know, and certain companies were saying that, you know, within a few years, you know, like 80% of the industry will be in aligners and braces will be a thing of the past. And it turns out that that was not correct. Most of our industry is still in braces, because as orthodontists, we like the tools and we like the incredible results that we're able to achieve with braces with a high level of control. And it turns out that patients also are still interested in braces. And we all know that because we have a lot of patients in braces. But what we're finding though is that patients do know what the other options are. And this is just something that now gives them the technology, the digital experience, the efficiencies, but still being in a braces system. So I think this has just generated a lot of excitement, and the patients feel good and knowing that they are using this very advanced kind of 3D printed system. So they don't have to go to other modalities of treatment in order to achieve that. They're able to get it within braces. So I think it's just really brought a lot of technology and a lot of excitement, new excitement about the braces experience.
Our next question is to either Dr. Waldman or Dr. Griffin. What else do you think would be customized outside of brackets?
So I would say that what we're doing is creating a platform for customization, mass customization in orthodontics. The first company to do that was Invisalign about 20 years ago. And they were a big win for the 3D printing industry because it's the first example of integrating 3D printing into manufacturing. LightForce is one of the very first directly 3D printed medical devices. And I think orthodontics as a specialty values customization than any other specialty of medicine. For example, you can be a few millimeters off on a femur implant and the matrix scaffold's it's gonna work, it'll fit. Whereas in orthodontics, if you're off by half a millimeter on a premolar or a molar, the patient's gonna feel that when they occlude. So without talking more about the product roadmap, I'll just say that use your imagination and think about the tooth moving tools we use today and what can be possible with customization and 3D printing. So it's an exciting time to be an orthodontist, and LightForce is all about creating technological weapons for the orthodontist to do their job better. None of them will make a bad orthodontist a good orthodontist, but if you know where to take the teeth, customization is a weapon to let you do a better job. So that's how I respond to that.
What colors do the brackets come in today?
So today we have one bracket color. It's very white. It's opaque. Again, as Dr. Waldman alluded to, it makes the colors pop more. It is ideal for the teens, adolescents. They don't care about the customization as much. Sometimes the boys care about the fact it's 3D printed, but you just put it in your treatment planning room and people will pick it just because it's the most attractive bracket to them. For orthodontists, what that means is we need to recalibrate our expectation for what is an aesthetic bracket. When patients come in to me and ask for aligners, middle-aged, people asking for aligners, LightForce is not for them. What we're doing and what LightForce is not antagonistic to clear aligners. It's actually quite complementary. It's about making your whole practice digital. You will see some things from us this year that will unlock the adult market as well. And there's many more possibilities in the future. But you'll see something from us later, probably Q4, that'll address the adult market. Anything else, Dr. Waldman?
I will say that we have used, I think there's a little fire situation here, so hopefully you can hear me. I'll get closer to the mic. But we have used this both for adults and for teens, and we have found that both really like how it looks, and we have not had any issues with that. We've done it for adults, for general alignment, for surgical cases, for all of the applications. So, yeah.
Are there any other cases you'd recommend that are ideal for LightForce brackets over others?
I'll take the first stab.
Dr. Griffin, do you want to take that one?
Oh, I was gonna let you take the first stab. Go ahead.
Okay. Okay. No, you know, there are certain cases where it absolutely shines, where when you look back, you're like, how did we even treatment plan these or kind of think through these cases when we were doing kind of an analog setup? But you get to the point where you think that about all the cases. So we were so blown away by this technology that we did not differentiate. And of course, anytime you're utilizing and learning a new technology, you need to do a certain number of cases to really understand it and to learn the system. So we do not, you know, differentiate in our practice between an easy case or a hard case. We're going to recommend this as the ideal fixed appliance for every patient, because as you saw, even in some of the more mild or moderate crowding cases, the ability to accurately finish the case in a short amount of time with no detail bends and very few appointments is extraordinarily valuable for an orthodontic practice.
Yeah, my answer is that it is the same. I mean, at the beginning of this, maybe a year and a half ago, 2 years ago, orthodontists, our earliest beta users, were submitting cases that they thought would be ideal cases. Some of them, they were both at the extremes. We would either get, you know, crazy craniofacial case, surgical case, or we would get super easy class 1 crowding. So no one was really submitting those middle cases. As Dr. Waldman said, now it's more like you're either digital or you're analog. So we're getting all of the braces cases or none of them. It's something that you kind of adopt as a system in your practice. The cases that I would struggle the most with doing without LightForce would be like the canine substitution, premolar substitution cases where, you know, like for the 3s, you turn them into 2s, you want to reduce the canine eminence. The first premolars, turning them into canines, you want to lift the lingual cusp, drop the labial cusp. Those were always the hardest for me to do with one-size-fits-all brackets, because you're really trying to optimize the torque. But to Dr. Waldman's point, there's not a case that we don't think you would benefit tremendously from customization.
Okay, this question is directed to Dr. Griffin. How would you suggest starting out with LightForce? What is the typical order for a beginning user?
Oh, well, usually people want to dip their toes in the water and do a few cases to start. What that means for the average new user is about 10 cases just to learn the system. What they usually do is submit 3 to 4 cases a month for 3 months and get used to the system, get used to bringing it into their practice from the treatment planning point of view, setting up the cases, their TC learning. So we have some instructional videos, and our staff, we bring a team approach to practice integration. So we train the TCs, train the doctor, train the assistants how to efficiently bond. We see, we're already seeing most of those people transitioning into full adoption. So, but usually, to answer the question, usually 10 is what we usually see people start with.
Yeah.
And the final question is to Dr. Waldman. I have a fairly large staff across my various practice locations. How does one receive onboarding for this type of new technology?
Yeah, I think that, you know, what's kind of interesting about LightForce is there are a lot of technologies out there these days that are undoubtedly very difficult to learn. They are custom. They kind of are trying. It's the same answer to all of the problems we're dealing with in our industry right now, but they're very difficult to learn because they're different and they're quite foreign to what we're used to doing day to day as an orthodontist. kind of similar to how you have to completely learn how to move teeth with plastic when you start doing aligners. It's a totally different way of thinking. With LightForce, it's braces. It's just like extremely advanced straight wire treatment. It's much better straight wire treatment. So the ability to roll this out is quite easy because our assistants know how to work with braces. They know how to tie in wires. Orthodontists already know braces mechanics. This looks and feels very much like a bracket, but it's just the guts of it, right? Like what's under the hood, totally different. And so you're getting a sports car under there, and so you're gonna get to the end of the road faster, and you're gonna have a better user experience. So I think that it's very easy to adapt over one practice, over multiple practices, and obviously anything that's digital can and should be very scalable without a lot of problems or issues. And LightForce is actually unbelievably easy to kind of utilize, despite the kind of inherent sophistication of the engineering and of the system itself. I think Dr. Griffin has done the industry a tremendous thing by providing us with such a sophisticated solution in a simple and straightforward way. And that's what we have found in our practice.
I wanted to thank everybody for questions, but we've run out of time today. So if we did not get to your question, we will answer it after the webinar via email. Please be sure to take the free CE quiz associated with this webinar. Shortly, we will send you a recording of this presentation and instructions on how to access the CE quiz. We appreciate you all again for attending, and a special thank you to Dr. Alexander Waldman and Dr. Alfred Griffin III, and our sponsor for this webinar, LightForce Orthodontics. Thank you and have a great evening.
Thanks,